Influences of Health Building Your Screening Roadmap. We appreciate you all for joining us, and we have a lot of great content prepared for today that will be presented by our stupendous speakers. Additionally, I wanted to take a moment to mention that this session will be recorded, and recording along with the slides will be posted on our website and an additional email follow-up. I just wanted to tell you a little bit more about the School-Based Health Alliance. Many of you are familiar with our work, but if you're not, I wanted to give you a quick overview of who we are. We are a national organization that works to support and advance school-based healthcare. We do this through policy work, we offer standards to the field, we do data collection, and we provide training, technical assistance, and consultation to support school-based health centers from the planning stage all the way up through expansion and improvement. Before I move to the learning objectives today, I wanted to review some housekeeping and reminders. You can hear us, but we cannot hear you. You can use the Q&A icon at the bottom of the screen to ask any questions you might have, and also put them in the chat. We will have a portion at the end of the session for questions and answers. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. We will also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us provide the best content and tailor it to the voices of those in the field. I'll give you a moment to review today's learning objectives. Participants will be able to identify evidence-based tools to detect needs and strengths in children and adolescents, strengthen school and community partnerships to address needs, apply best practices in care coordination and follow-up. All presenters will take a moment to introduce ourselves to you, starting with myself. My name is Mandy LeBlanc. I'm a contractor with School-Based Health Alliance based in Seattle, Washington, with over 20 years of experience in school-based health. And I'll toss it over to Donnie.
Thanks, Mandy. Hi, everyone. I'm Donnie Greco. I'm an associate here with the School-Based Health Alliance. I've been here for 3 years. And I'll toss it over to Todd.
Hello, everyone. My name is Dr. Todd Moore. I'm with the American Academy of Family Physicians, and I am the director of the Center for Diversity, Health Equity, and Global Health. And I'll toss it over to Jay.
Yeah, my name is Jay Bohannon. I'm a specialist at the American Academy of Family Physicians.
First, if we could start with introductions by putting your name, your role, and an emoji check-in for how you're feeling. Then I'll toss it over to Dr. Moore.
All right, how are we doing in the chat? We getting some things in there? There we go. Welcome, Amanda, Kyra, we see you. Dr. Abby Page, welcome. Alyssa, welcome. Okay. Shalita, welcome. There we go. They're coming in. Gretchen, hey there. Christina Belaski. Victoria, welcome. All right. Stacey Summers. That's a fun name. All right, let's get started. Dive right in. And what we're going to talk about today, we're going to really start to talk about how we think about all the factors that influence our health. We're going to dive into this topic, but we're going to just get started with getting your brains going a little bit. What are some of the factors that influence our health? Can you put those in the chat? What are some factors that influence health? You can name anything.
Yeah. Exercise, culture, community, stress, healthcare access, sleep, nutrition, motivation, living location, access to care, environment, community, family, income, genetics, motivation, I think, nutrition,
Sleep. Yeah, Christina's on to something there. Okay, great. So next slide. Thanks for pointing out some of those factors that influence health. Here's some additional factors. Some you may see already noted that you put in the chat, and maybe some new ones here. Does anyone see anything that they see as new or something they didn't consider as a factor? You can throw that in the chat now as well. Or anything on this list that, or anything else we're missing from this list and the list that you put in that you'd like to highlight. A lot of folks, when we do these exercises, forget about the spiritual, religious values that can impact your health. There we go. Yeah, Shalita, that was a new one for you, or something you didn't consider. Yep. Environment. What does it say?
Early childhood environment.
There we
for
go. Okay.
Long-term health outcomes by Abby.
Yeah. I would love for you to say more about that, Abby. We may get a chance to do that later, but hold on to that and know that that's a really important one too, right? 0 to 6 is so important. Anything else?
I know I'll say that one that I've heard through discussions is the access to nutritious foods. I know we talked about it a little bit, but that's one that many people don't even think about until you're actually considering and having those discussions. So that's always like, oh yeah, that's a super important aspect, like one that's almost completely fundamental. But I know that's one that a lot of people have seen this and said, didn't even think of it until we talk about it.
Yeah, that's a good point, Donnie. Thanks for that. And Angela, I see you with the social status there. It's right there in the last column, the third to the last down. But I do appreciate you pointing that out because that has it's a big factor, and we're going to talk more about it. So let's get to it. Next slide, Donnie. So because we're working in school settings, it's important to think about factors that impact children's health outcomes, because the ones we just mentioned, think to yourself, other factors you can think of that play a role in a child's health, right? So Donnie pointed out a good one, which is food, access to nutritious food, right? What are some other factors that could impact a child's health outcomes? And you can even talk from your experience here. Just throw it in the chat. Okay, Lori, I see you. Food insecurities, right? Yeah, peer pressure, violence, bullying. Thank you, Tanya.
Friend.
Social media. Okay. Alyssa says mental health. That's true. Right. Two for social media. Mental health. I don't know if you can see this slide as clearly, but the first time I did this slide, I didn't see it. And now when I've looked at it closely, every one of the pictured people in the slide has a different type of issue they're dealing with, right? The guy, if you see real close to us to the bottom right, his hat says HIV on it. I didn't catch that before. I just thought it was something else. And then when I look closer at this slide and when we were developing these, I was like, wait, each one of these kids has something they're dealing with. This one kid's sad by the lockers. One kid's bullying. They're videotaping the bullying. There's one kid in between the hungry kid and the kid right next to the hungry kid. I can't see that. I forget the other guy with the sleeve, something on his sleeve, but he doesn't have anything, or I couldn't find anything on him. He's the only kid that isn't dealing with an issue. This is kind of a metaphor for the types of things that kids face. And typically kids are going to be facing something, right? I think most of you would have working in school-based settings would agree that this is a really important issue that kids are going through a lot. Okay, let's move on. Factors that influence our healthcare are called drivers of health and fall into these larger buckets. One kind of determinant of health is what is in our genes and our biology. Another determinant is in our individual behaviors, such as whether we exercise, vape, or eat a balanced diet. Many people assume that their health is a result of their genes, their behaviors, and often they get sick or go to the doctor. But it's not just how you live that determines how healthy you are. Social, economic, and physical environments have big impacts on our health as well. So think to yourself, Do you think any one of these drivers of health categories, like being genes and biology, individual behavior, clinical care, and social, economic, physical environment, play a bigger role in our general health outcomes? Or are they all about the same, influencing our health? So take a moment and throw something in the chat about what you think is the biggest driver of health among these four factors. Oh, ACEs, that's it. Thank you, Shalita. That's what's on his arm. You're right. Okay, so Christina says socioeconomic. William Dempsey brings up a nature versus nurture argument, which is an interesting one. And that's something that we can definitely delve into and when we get into the modules. Socioeconomic and physical environment. Okay, Alyssa socioeconomic. Abby says clinical care has the smallest influence. Okay, Abby inverted the question and said, here's what I think is the smallest. Okay, I'm okay with that. Go on, Abby. Okay, so according to research published by the Robert Wood Johnson Foundation, social factors, economic factors, and physical environment account for 50% of health outcomes, whereas clinical care is only 20%. So Abby, you're right about the lowest number, and many of you others are right about the bigger numbers. Okay, next slide. Factors that influence health outcomes are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And that's a definition used by the CDC. The World Health Organization goes a little further and adds that the broader set of forces and systems that shape the conditions of daily life include the distribution of money, power, and resources at global, national, and local levels. This distribution is based on political and economic policies and systems, social policies and norms, and societal institutions. Therefore, the distribution can be challenged and changed. So influences of health are divided into several buckets, and there's a graphic that I'm going to use to show you some of those different factors that influence health. And it's a graphic used by Healthy People 2030. And so the next slide will talk more about that. Here are some of the examples of how these different conditions relate to youth. Education, access, and quality. Think about preschool programs. Some of the most recent data shows that the number of states meeting all 10 of the National Institutes for Early Education Research quality standard benchmarks have changed. Currently, 6 states meet all 10 benchmarks, just 6 states. These benchmarks include criteria such as 1 to 10 staff to child ratio and specific training requirements for lead and assistant teachers. So economic stability, think about this. The researchers from Columbia University found that children were experiencing a higher poverty rate than any other age group during the pandemic, mostly due to the factors that parents, especially those with younger children, were more likely to be unemployed. In 2023, the child poverty rate, it was 16%, and around 11 million children lived in households where kids couldn't get enough food because their families couldn't afford it. Healthcare access and quality. Confidential STI screenings is one of the factors here. So there's some data that looked at incidence and prevalence estimates on STIs, and they suggest that young people aged 15 to 24 acquire half of all the new STIs, and that 1 in 4 sexually active adolescent females has an STI, such as chlamydia or HPV. Neighborhood and built environment. Safety walks to and from school. Many of you may have have a walking school bus or took the school bus to school. There are many initiatives that encourage children to walk and bike to school. National Walk and Bike to School Day to increase physical activity. But if children do not feel safe walking or riding their bikes to school, they're probably not going to get to school that way. That's just give you some ideas about a couple of those factors that can relate to youth. Let's go to the next slide. So in recent years, a growing body of research has highlighted the importance of addressing the social factors that influence health and the access to health opportunities. By ensuring that everyone has a fair chance at better health, we can improve overall quality of life and reduce healthcare costs. In fact, inequalities in health opportunities are estimated to account for around $93 billion in excess medical care expenses and $42 billion in lost productivity every year. In addition, in addition to the economic losses for premature deaths. So next slide. So you've seen this slide before, and a fair, just distribution of the social resources and social opportunities needed to achieve well-being is valuable. Sometimes can be mistaken for equality. According to the dictionary, Merriam-Webster, equality is the quality or state of being equal. And so this idea, this image is something that you've probably seen before. How many of you have seen this image before? Just raise of hands. I'm just curious. Can we raise hands? Donnie, can participants just push the raise hand button?
They might just be able to type in the chat.
Okay. Just throw a thumbs up in the chat if you've seen this image before. Thank you, Bella, for the actual words raised hand. I appreciate you. Yeah, this is a pretty common, image. Let's delve into this image a little more, right? Next slide. On the left side of the image, we see that all three individuals have a box to stand on to watch the game over the fence as the fence is blocking their view. The box is identical for everyone, which ensures that everyone receives the same resource. What's this called? Right? Equality, right? But as a metaphor, next slide, Donnie, the metaphor, the box represents the resources and tools these individuals have been given. These resources can be community and health programs and interventions, right? Many of you have seen these or been a part of these interventions. This metaphor, that box symbolizes those interventions. These tools are used to serve their patients and your clients and your community members. The boxes can also represent the processes, protocols, and data collection and organization health system use, as well as policies. Ultimately, what happens and what we see in the scenario is that the other factors may impact how one experiences the ball game are fully taken into consideration. So when everyone receives the same box, or in other words, the same resource, the same intervention, the same programs, same processes, without consideration for other factors, it limits the game watching experience for some and unnecessarily provides resources to those who are already watching the game. How exciting can this game be for the individual using a wheelchair? Not only are they not seeing the game, but the box they were provided is inappropriate and possibly traumatizing to that individual. Instead of helping, that box just became a source of hurt for that person. When we take factors that impact health into consideration, we adapt interventions, protocols, and processes and policies to fit the need. Consider weaving them into the planning of healthcare can help provide your delivery of services and interventions to meet the needs of people. So we place focus on ensuring everyone can have the same outcome. The outcome here in our example is to enjoy the ball game. Appropriate supports and resources are used to achieve this outcome. Having the same outcome is different than having the same intervention. An individual who uses a wheelchair doesn't get a box at all, but rather a ramp. Interventions, processes, policies, data collection are all designed with influences of health in mind to reduce disparities in outcomes and improve overall health outcomes. So this is all a process, and you don't get there real quickly. Sometimes it takes some time, but we should strive to continually address barriers placed in front of people. So in this example, we see the fence, which is literally a barrier removed. Maybe that was something that could be worked on to improve the overall experience, the outcome we want, which is the experience of the ball game here, right? This impacts all of us who've been looking at this analogy from the point of view of the fans, but how about the point of view of the players? Did you consider them? Wouldn't they rather prefer to see fans cheering them on? This is so funny because in real life, my kids play soccer, and I'm in the middle of the country, y'all, and it gets cold here, and sometimes soccer games can get cold. And I went to my car to watch the rest of the game. And I'm in my car sitting looking over the fence, literally over a fence, watching my kids play. My vision was obscured. The process wasn't as enjoyable at all, but it's different. It's a different view of engaging with my son and his soccer playing from the car, from staring over a fence, than if I would if I'm being able to see directly on the field. I'm sure this is relatable to you and in your lives as well. This idea of these different viewing us the similar thing in from different perspectives can be helpful in understanding everyone's frame. Next slide. The reality is that when we take historical factors and policies into play, we realize that not all people are on the same level field. Some people never receive a box, right, of resources, while others have access to multiple resources. So any thoughts anyone would like to share in the box on this? This is an interesting, I really appreciate this series of how to engage with this very common image to show a lot of different perspectives. Any thoughts that someone would like to share in the chat? I know it's a lot to be able to share a thought in the chat, but did this resonate with you? A thumbs up could be there. If there's something that you had a question about, we can address later, or you can put it in the Q&A box now, but just wanted to give you a moment to reflect on this.
So Courtney says that they've never seen the photo. It definitely resonates with me, especially thinking about the player's perspective.
Mm-hmm. Yeah. And I think about it from my son, one time when he was much younger, his mom said, "Hey, I'm going to miss this game. Is that okay?" And he said, "No, I want you to be there." And I think that's, just the idea of being able to know that the player on the field is impacted by the people who watch them is important. So removing barriers is powerful. I saw that. It's true. Anything else you see there, Donnie? Thanks for the thumbs up, Esmeralda. Esmeralda. I'm butchering your name. You can correct me later. Okay, let's continue. So let's just take a moment. Let's take a moment, quiet reflection, to think about how all of this impacts health outcomes. Just take a moment, take a deep breath. I'm glad we were able to look at this image. Just take all of what we've just said in for a moment, and if you have, I really want to give you this moment to jot something down in the Q&A, or even if there's something else you wanted to take a note on, or this is the time to do that. I just want to give you just a quick 30 seconds to do that. Jennifer says she's a short person behind the fence. Oh, Jennifer, you need the double box, don't you? Okay. Okay.
Bella shared the website.
Yeah. Thank you. Who's that? Is that Bella?
Bella, yep.
Thank you, Bella, for that. Okay, let's continue to move forward. So tying this all together, what can we do? Well, we can't do much about someone's genes or biology, but fortunately we can do something about the influences of health because they're human-made. We can challenge and influence social, economic, and physical environments, and growing research shows that addressing influence of health and unequal access to opportunities for health can improve quality of life. Let's start talking about those. So, practices with a growth mindset culture strive to understand their patients' lives and context. These practices look for ways to help their patients overcome hurdles to their health and healthcare. While there are a variety of ways to establish and enrich a culture of fairness in your practice, key strategies include those listed here. And understanding your patient's community, what barriers your patients face to living a healthy life, what resources are available to your patients and your community, public health data that can help with illuminating issues that your patients may not even know they face. You're empowering your whole healthcare team to make sure they have the team has skills that help improve and address the social barriers to health that your patients face. Learning about social factors that influence the health of children and adolescents is important. Social factors influence health through a complex web of causation, and understanding the different mechanisms to help improve patient care. So, what does developing a culture of practice mean to you in your work? So now's the time to pass it to you. Go ahead and put in the chat some thoughts about what developing a culture of practice means to you at your school-based health center or your in your work. I know this is going to take a little long because you actually have words to type other than one words or a thumb. So I'm going to give you, be patient and let you throw something in there. This is time when we cue the Jeopardy music, Donnie.
Yeah. Oh, I'm a Jeopardy fan. So
Adapting to the rapid changes of the community is developing a practice culture. Good. Thank you. Who was that? Kenya. Student voice. Oh, thank you, Bella. Yes, it's so important to incorporate student voice, especially when it comes to their health, because a lot of times they don't quite know how to articulate what they're feeling. And so having someone there to help translate is strong, but it's not really, it's not inappropriate, right? It's accurate. Translate, you need those student voices so you can help translate what's going on.
we also have Magali said, making sure staff are hired that speak the language of the community or adolescent friendly.
Yes. Literal translation is important, and yeah. Awareness of one's own bias. Thank you, Allison. And you put biases on there. You plural, made it plural. That's true. Fair. Sensitive inclusion, Amanda. Yep. A welcoming environment that includes diversity of patients and employees. Yep. Building a welcoming environment. You know what they say about churches have this really interesting data point. And one of the things that say that people go to church, one of the reasons why they go to a new church is that they felt welcomed. So it's so important that very first welcome, the very first welcoming, and going to the choosing a new church is one of the hardest decisions. The data shows is one of the hardest decisions to make. It's surprisingly really difficult. That's why people stay at the church they've been at for a long time. But so they say that the data shows that welcoming, that first touch that you have when someone enters a new church, that's the key. And so I think this is true, applied to any type of new experience, that first touch is important. Taking on a learner attitude. Thank you, Lori. A lifelong learner, Lori says, is important. Thank you. Okay, let's keep it moving. So has your health center reviewed its policies with a growth mindset recently? If not, this is a good place to start. Review your internal policies and identify if there are areas you can insert evolved goals at the patient, organizational, collaborative, and community levels. There's just a couple of questions you can consider, and they're listed. Some of them are listed there. Does your center have a policy to use plain language in all patient education materials? Do you have a patient advisory board? I love that someone talked about student voice. Patient advisory boards can be an important aspect to being able to make sure your patient population is your clinical care is reflected in your patient population. What are the agencies in your area you can collaborate with? Can you strengthen partnerships with those? Consider your organizational goals too. Everything you do should be directly tied to your goals, and so to make sure that your goals help reduce health disparities and increase positive health outcomes. Yeah. All right, next slide. So here's a Zoom poll asking about, you know what, let's come back to this, Donnie. Let's go to the next slide. I think this is, apologies, I think these are out of order. Let's just talk real quick about community health assessment, then we'll come back to the poll. Let's just talk about it first. So how many of you have heard of a community health assessment? We normally raise hands here, but then don't worry about it. If you have, I'm going to tell you about it. A community health assessment, every county has a county health department in the US, and every county health department is required to conduct a community health assessment. So It refers to an assessment that identifies key health needs and issues through systematic comprehensive data collection and analysis. So the CHA, Community Health Assessment, is part of the health planning process. It provides organizations comprehensive information about the community's current health status, needs, and issues. It can include a variety of data collection methods, such as census data or ACS data, public forums, listening sessions, national surveillance surveys, community surveys, or public records data. So the information gathered can also address influences of health, such as access to healthcare and provider availability, educational attainment and experiences, the built environment, transportation, community assets, mappings of fresh fruits and vegetables, perceptions of residents, etc. The CHA is helpful and a precursor for developing community health improvement plan by justifying how and where resources should be allocated to best meet community needs. So let's talk about the community health improvement plan, the CHIP. So after you conduct after you do a CHA, the community health improvement plan is the actual plan, systematic plan to address the public health problems identified in your community. So each community may have a different set of community health, a different set of plans. So one community may be really focused on youth behavior and teen pregnancy. And it could also be about obesity reduction or physical activity. It could be about access to fresh fruits and vegetables or food deserts. So every plan is going to be unique to your community, your county, and it's going to be unique to the needs of those counties. Almost every CHA should be evidence-based, so it should have some kind of data around it. And the plan will then reflect how we're going to address that data point to move it one way or another. So it's a really important data tool for you to use in your community. So one more slide, and then we're going to shoot back up to the poll, Donnie. So the benefits of community health assessments and CHIPs. So I'm almost going to guarantee that every county you're in has a CHIP, has a CHA, and has a CHIP. So just know that there's some type of assessments been done in your county by your health department. Now, whether you plug into that or not is up to you. Just know that it's there. And one of the things they did is prioritize the health needs of your community. Now, when we go into the next stage, if you become part of the learning community, we're going to really deep dive in these CHA chips to be able to talk about not only those, but also these community health needs assessments, the CHNAs that are on the top of here, that what they mean to your community and what they look like. So here's a list. The bullets here talks about some of the benefits of these things, but they really are a shortcut for you to be able to understand what's going on in your community. If you go to that CHA and you go to that community health improvement plan, you see there aren't any adolescent or youth factors identified on there, then that's something you can either address there or know that, hey, our community doesn't feel like this is an issue. Now, you can feel any way about that. You can feel like, okay, that means we're addressing it. You can feel like, hey, this is overlooked. Either way, you can plug into that to talk to the health department and whoever runs their CHIP in your county about the issues that you're facing in your clinic. And this is an important connection to the community, right? Because this helps bring additional resources and help bring additional focus to your clinic. We're going to talk more about this, and I know you may have some questions. So Donnie, let's shoot back up to the group poll. So have any of you conducted or participated in a community health assessment or CHIP in your communities? Go ahead and throw a thumbs up in your Okay, I see your question. We'll make sure we get to it. You can circle back to it. Okay, good. So I'm seeing some thumbs up here, Abby, Esmeralda. Okay. Oh, and Amanda says no. Edwin says yes. Okay. Good, good. Looks like there's a lot of folks that know what these are, and that's a good thing. And if you don't know, I really encourage you to take a peek at your community health assessment and your community health improvement plan, just so it should be posted on your county's website. in the health department. And just take a look at it. You may be surprised that when you look at who's on those community, and almost always the CHIPs have a community organization, or excuse me, community volunteers that make up the coalition for the CHIP to help address those needs. And they sometimes have subcommittees. You can get involved at those levels to be able to really elevate the needs of not only adolescents in your community, but also your clinic. Because sometimes y'all are, I know last year we talked to a lot of clinics that are like, we are here, but we need people. We can use more patients. And so this may be a way to get more awareness of your clinic to the community through the health department and the CHIP. Okay. All right, Donnie, okay, you're on it. Get down here to some of these resources. So let's talk about some of the resources available to you. So we quickly review the CHA chips. And look, I just want to emphasize this, that this is a piece that if you're part of the learning team that's going to go forward, this is something we're going to really deep dive in, because I really think we really feel this is an important shortcut. And I call it a shortcut because the data is already collected, the information is already there. There are expertise in your county around this a lot of times. And plugging into that, I think, is a real efficiency for your clinic, but also it just brings so many positive things to your ability to serve young people. So so now you get an idea. This is just the review just to give you an idea of the understanding local issues and assets. So let's talk about just a few resources that can help you address some of the issues that directly impact the kids in your clinics. If you're not already familiar with 211, this is a great free resource you can use and share with your patients. Their website, 211.org, and their phone number is 211, literally, anywhere in the country. There are more than 200 211 agencies across the United States, each with a team of trained community specialists who are available to help you access the best local resources and services to address any of your needs. So if you come across a need that your patient says, hey, we're food insecure, or you develop a social needs screening form that identifies one of these determinants, then you're able to go right to 211 and type in your zip code and type in the need, and it'll pop up the resources in your area, as well as some other additional really interesting resourcing components there. They can actually hop on a call with someone and talk you through it. They can connect you directly. There's a lot of other functionalities to 211 that can be applied, but just basically just typing in the zip code will get you directly to the resource. 211 responds to more than 14 million requests for help every year. So in 2018, the AFP, launched the Neighborhood Navigator tool, which is a nationwide community resource guide, very similar to 211, that's supported by Find Help, the Find Help platform. It works the same way as 211. You go to neighborhoodnavigator.org, you type in your zip code, and you go to the resource. Now, we mentioned both of these next to each other because they really are collaborative. 211 sometimes does a different type, or can be more local, and so you may find more if you're in a rural area. 211 may have be more up to date, have more resources for you. If you're more urban, then Find Help will access a lot of the same references that 211 have, but also have some additional functionality. Navigator can connect right to your HIE. If you have it's a health information exchange, it can connect directly to your electronic health record, and then be able to connect your patient directly to the resource. So some different functionalities, and we're going to talk more about those when we go into our modules. But just know that your EHR can often have a social determinants of health screening tool in it, and it can also have a HIE in it as well, a health information exchange, where you can connect the resources directly to the patients within your EHR. So lots of acronyms there. Apologies for blooding all that out, but I think you guys are following along. And if not, we can just post it in chat. We can clarify any of these acronyms there. Next slide. The next resource, I think, is a really interesting one. If you aren't familiar with this, it's called the Community Toolbox. It's a free online repository to help one access community needs, address social terms of health, action planning, other things as well. The Community Toolbox is a service of the Center for Community Health and Development at the University of Kansas, and it has a robust collection of tools for community assessments, from how to conduct community listening sessions to priority planning. So if you're looking to develop, like say, a patient advisory board, the Community Toolbox could be a resource for you to help develop that resource. So just knowing that to access Neighborhood Navigator, again, just type in your patient's zip code and search for the toolbox. Keep going to the next one. Next slide. So let's just stop there. We did a lot in 40 minutes. I really appreciate your engagement throughout this time, and know that we're going to be ready. Our team here at AFP is going to be ready to work with you as we go into the modules, and the upcoming learning collaborative that we're conducting soon with School-Based Health Alliance. So, Donnie, Mandy, back to you.
Great. Thank you, Todd. First, it looks like we'll have a questions at the end. I'm just going to blaze through a few more slides and then we'll open up to questions. So just to continue the conversation, we are about to have a learning collaborative that takes what Todd and AFP have been starting and goes on a much deeper dive. So we're going to build on the momentum from today's webinar. We're launching a learning collaborative to explore screening tools, school community partnerships, clinic workflows, and sustainability strategies in much greater depth. The sessions will kick off in March, starting March 18th through April 22nd. Interactive discussions, expert-led sessions by Todd and his colleagues, and actionable insights facilitated by School-Based Health Alliance and AAFP with Todd and his team. First, we're going to ask, would you be interested in learning more about this? And if so, for those that say yes, we're going to send out some more information to you. So we'll take a good 2 minutes here to let anybody that says that they're interested fill this out. No worries if it's a no, but we would love to have as many people as are interested, and we'll then send you out some information for next steps.
And I just want to add, this is by no means a commitment. We just want to gather interest. We want to see who wants to keep up these discussions. Like Mandy said, no worries if it's a no, but we want to reach out to those who are saying, yes, we want more information. We are looking on how can we improve our health center, our organization? How can we kind of utilize this to improve our own processes? So yeah, just take a minute. But like I said, feel free to add. Don't think that you are married to, oh great, I said yes and now I have to do this and I'm locked in and what's going on. Not anything like that. It's just I want more information and I would like to look forward to that. Exactly.
We'll give it about 30 more seconds for people to respond, but we're seeing a lot of people that are interested. If you want to just if you haven't answered yet, feel free to add to the poll. And again, it's a commitment to learn more. It's not that you're signing your life away or anything like that. Great, and we will be following up and sharing more resources in the future. Which leads us to the next slide, which is looking forward to your feedback. We're going to now send out a poll to hear what you thought of this. We'll give it a few minutes for everybody to answer the poll.
And while you're answering, I know Mandy mentioned at the beginning, but I just kind of wanted to reiterate, the reason why we utilize polls like this is to better provide content, to encapsulate more voices from those in the field, to see people, they say, you know what, we're really strong about this topic, and we'll know, okay, great, that's an area that people are focused on. Whereas if there's one that people are saying, you know what, we need some more help, we need some more development, those are then targets that we can think of, and how can we build upon that? How can we kind of take this and utilize those strategies to kind of expand who needs what, and what are the most common topics that are in the field, or in the voices of those that we're kind of experiencing, and who attend these webinars and attend various activities that we host. So that's kind of the reason why we have this. I know sometimes people see polls and they're like, oh, I don't want to answer this, but please know that it is extremely important. We definitely use this. We go over it as a team. We take it back and say, this is how we're going to compile some new information. We keep trying to, blaze a path forward with what we know and what others want to know.
Right. And we'll give it one more minute for everybody that wants to complete the poll to complete it. There are several questions, so 5 questions looks like. So if you could just make sure that you get a chance to answer all of those, we would appreciate it. And it looks like it's getting quiet, so we'll move on to just honoring that the National Training and Technical Assistance is our funding partner for this. We also have some additional upcoming webinars, including childhood preventative healthcare services, making life easier for students and families, that we will offer on March 13th from 12 to 1 Eastern Standard Time. There is a QR code on the screen, and will also be, if you follow us on LinkedIn and other sources of social media and email, we'll be sending information out for that. And we have a whole other series coming up. So please keep an eye out for additional webinars such as these, thanks to our partner, National Training and Technical Assistance.
And this link will be available in the follow-up email that we send out after the webinar.
Thank you, Donnie. We also have our School-Based Health Alliance website, which has more resources. When you go to www.sbhforall.org, then click on Resources, then click on eLibrary, and you'll see the BPIC NTAP, BPHC-NTTAP, for a whole library of resources on these topics and way more. Next up, we have our National School-Based Health Alliance Conference, Healthcare Conference, June 29th through July 1st of this year in Washington, D.C. You can go to the website to register for that. And we hope that you stay connected through our social media. We have Facebook, Twitter, LinkedIn, and Instagram, and you can scan the QR code to subscribe to our digest. Thank you to AFP, Todd, Jay, Donnie, and now we get to open it up to questions. So you can either put the questions in the chat or raise your hand and we can see if we can allow you to verbally ask your question as well. But the chat is perfectly fine too.
I answered 2 questions earlier in the webinar chat there about how often are community assessments conducted, and typically about every 3 years, but it just depends on your local health department. Typically it's the health department or led by your local health department. Bella brought up a good point that her FQHC or FQHC that she knows conducted a health assessment, and some health systems are required to conduct a health assessment. So it's not surprising to find some hospitals or health systems that have some type of community assessment conducted. Some aren't required, and academic health centers are kind of in that gray area. So sometimes they're required, sometimes they're not. So if you go to your local academic health center, you may not find a community health assessment, or they may just plug into the local chip. So just know that's always an option. And I tell you, the health departments really find it a attaboy when they're like, "Oh, you're just going to use our data? Thank you." You know, like, we did it. It means something to someone. So know that they're really appreciative whenever you're like, "You know what? We're going to do this, but we're just going to plug into y'all stuff." And they're like, "Okay, great." You'll make a friend like that way real quickly. Any questions that anyone has about anything that we talked about, or comments or concerns or thoughts or whatever you like to share? Are we still on we're still on the chat function? No one can unmute. Can people unmute? No, okay.
You can just type in the chat.
Thanks, Dottie. I'm sure you told me that. I apologize.
Okay, no. Yeah, please feel free to type in the chat if you have any questions, or in the Q&A, whatever you feel more comfortable with.
Okay. That means I must have did a pretty comprehensive job. Let's ask any questions.
Yes.
Well, I'll just say that I look forward to working with the folks in the Learning Collaborative. If you get a chance to be a part of that, I really encourage you to participate. It's it's a really good opportunity to really get to real drill down and talk about how your clinic can really be a part of, can either be more part of the community, how it can be a part of the community, how you can best serve your patients. If you're looking to develop a social needs screening tool, what that means, what that could look like to be able to do that in a way that's going to improve your patient outcomes, and how to track that and measure those outcomes, to really have a way to get funding. I will tell you, when you apply for local foundations, a local or regional foundations, and you're able to show that here's our data, here's how we know this is an issue, which we plugged into the CHA. We know that this is an issue. It's identified their adolescent health. We're doing that work. This is how we're doing it. And then here's what we're doing to execute that plan. That really resonates with funders. So, and that's one of the things that we'll talk about at the learning objective, the learning collaborative. So
Thank you, Dr. Moore. And we do have a question here, which
Okay.
is, how can schools and health centers ensure comprehensive screenings without adding too much stress on students and families?
Yeah, that's a really good question. I think that's a real balance, right? Part of it is understanding your community and knowing what they need, and then being able to reduce the administrative burden on your clinic staff at the same time. And what we've seen here at AFP is that we're able to do, we can reduce burden if we're able to increase our ability to use community resources. So the idea around engaging in the, for example, if you have well, this is not a good example for y'all, but just it's the easiest one for me. Diabetes, like if you have patients that have diabetes, and there's a diabetes prevention program that most YMCAs conduct. So you can partner with the YMCA to help address, your clinic can partner with the YMCA to refer patients to the YMCA to be able to, not only for that person to have the ongoing support and connection and access to physical activity and other resources that the YMCA has, they also can build a community, right? And so we know lots of great data that says that, you build a community, you're able to do anything. You can reduce health outcomes, really improves health outcomes the bigger your community is. So those types of bridges is kind of the way to reduce the administrative burden on clinics, but also improve health outcomes, right?
Great. And we have another question that came in that's, are there budget-friendly ways to integrate screenings into existing school health programs without compromising quality?
One more time, because I can't see the questions on my.
Sure. Are there budget-friendly ways to integrate screenings into existing school health programs without compromising quality?
Yeah, in fact, some improve quality. So if you're using an EHR, for example, there's going to be almost positive there's a button on your EHR you can push to activate the social needs screening tool. There's going to be an on switch for that. Almost all EHRs nowadays have social needs screening tools connected to it. So if you're using EHR, then you have a tool that can help you screen for social needs. That improves quality, it improves efficiency, and allows you to identify patients' needs before they get to it.
Right.
Mhm.
And the last question that we'll ask is, for someone new to implementing social needs screenings in a school-based health center, what advice would you offer to help them get started?
First is the things we talked about in the slide in the deck, like just doing a real scan of what's going on in your clinic. That scan really helps to develop. Let me find that slide. I think that slide was the idea of reviewing and developing your policies and processes. So that idea of just going back and reviewing those and taking a look at some of the things that, the opportunities for internal policy changes, cross-sector collaboration, what are mutually beneficial goals, how do we meaningfully engage stakeholders, and having those conversations internally around that. Okay, Donnie pulled it up. That I think is a really good start. And that's kind of like your internal assessment to see where you're at, right? And that allows you to know what pathways you can move forward as far as if you even need social needs screening tool. Sometimes it's like, do we really need this tool? Maybe we're already doing it. We're doing it in a different way, or we call it a different term, right? And so doing a scan, this environmental scan of your organization, kind of really sets it off to allow you to have a good foundation to move forward.
Great. Thank you. I think unless anything else to say, we can allow everybody 5 minutes to transfer to their next event today. And thank you all for attending. And thank you to Dr. Moore and AAFP for presenting today.
Thank you.
Thanks, everyone. Have a great day.